All right, almost everyone I know has been itching to shed the sweaters and embrace their spring and summer wardrobes, which of course includes swapping those boots for flip-flops and sandals. But the question is, are your feet ready for that? You may not have even considered this before, but Dr. Sarah Abshier is here to make sure that you do. She is with Orthopedic Foot and Ankle Center, the sponsor of this segment. So thanks for being here.
Well, thank you for having us.
All right, despite the temperatures of the day, maybe, we are all kind of itching for spring. I've seen plenty of sandals already out there. What do you mean by making sure, though, that our feet are ready for that? Because we don't often think about that.
Sure, so start looking at your feet now. A lot of people don't moisturize adequately. You want to be looking for lotions and creams that draw fluid and moisture into your skin. We call them humectants. Examples of those ingredients you should look for in your lotions and creams are urea, hyaluronic acid, and even glycerin.
And I'm almost afraid to ask this, but I Googled it yesterday, so I kind of know the answer, but why are flip-flops so bad for us? Why should we not be kind of wearing them everywhere we go?
So they are stylish, and they do tend to keep your foot a little bit on the cool side, which is nice in the summer.
Sure.
But those thin straps don't really keep your foot secure in the shoe. You tend to get over gripping with the toes, and for patients who have hammer toes, that actually makes them a lot worse. In addition, if they don't offer any support, you can end up with plantar fasciitis from that combination of gripping of the toes and a lack of support. There's other things you worry about too. A lot of flip-flops and sandals do not have adequate padding in the heel, in that cushioned area. If you don't have enough cushion, all it takes is one day at the zoo or at the Ohio State Fair to end with bone swelling or even stress fractures.
Wow, and so is there something else we should be looking at or something that we should be looking for in a sandal?
Absolutely. So when you try them on, make sure they are kind of snug and they keep your foot in the right position, that you don't tend to feel your toes clawing and curling when you wear them. Have a little bit of a support in the arch, and definitely a padded heel.
And it's interesting that you say just some of the bigger foot issues too, because do you look at somebody who maybe has some of these ailments and ask them what kind of footwear have you been wearing? Does it lead to that down the road, even if we don't feel it now?
Absolutely. Every year we get tons of patients who are coming in after a whole day in flip-flops or sandals, and they deny any kind of trauma, but they suddenly sustained fractures, and we can always trace it back to those shoes.
And what are some of the most common kind of foot and ankle conditions too that people struggle with when the weather changes?
Sure. So with the increase in moisture and the increase in heat, we see fungal infections in the skin and in the toenails. That same moisture coupled with the shoes that don't fit just right, you end up getting blisters. We get bacterial infections, problems along that line. The biggest thing we probably see is overuse syndrome, and that can catch up with people. You've been cooped up in your house all winter in Ohio, and now you want to get out and be as active as you possibly can be. That's not entirely safe. We always say 10% per week is a rule of thumb. So whether it's steps, miles, minutes on your feet, you should really add 10% per week and build up to that high activity level. Otherwise, you could be looking at being sidelined halfway through your summer.
And you mentioned kind of some of the sports, the activities, right? I mean, I've got some young kids. Are there things that can help them when, they're about to go play soccer, play something that's very physical on their feet?
Right, absolutely. So make sure you check your size when you're going into your season. Make sure that you have adequate room. Kids grow so fast and in spurts. Make sure you're tightening the laces. A lot of people just slip their foot on and go, or their shoe into their foot into their shoe and go. But if they're tending to do stop and start sports like soccer, things where they're pitching side to side, they'll be ramming their toes in the end of that shoe if they're not laced snugly.
And do you know when it's time to go in and see someone about it? If they have one fracture, is that okay to heal from, but then hey, the second or third we go see somebody?
No, really you should actually start looking at your feet before you have a problem.
Okay.
An ounce of prevention is worth a pound of cure. Even if you have something that's just unsightly, get in a few weeks or a few months in advance. You don't want to wait until the day before the pool opens or right before you're about to go out of town to the beach to try and solve these problems. They can take a while.
And it's interesting, you're holding a model of the foot there, and that just shows how many bones are in there that you can impact, that can have a problem.
Right, and I wanted to show the reason we have kind of issues with wedges and heels, although they do look very pretty, is that we tend to destabilize the ankle. When we pitch the front of the foot down, this bone here is called the talus. It's part of the ankle joint, and it's more narrow at the back. So having it at this position really destabilizes your joint. One of the rules of thumb is 2 inches or less for 2 hours or less for foot safety. Also, when it comes to wedges, try and get the height difference between the heel and the ball of the foot closer with more of a platform than, say, a wedge.
Okay, good to note. You know, and I always used to say, you know, beauty is pain, but that's like in your 20s. Now I'm totally about, you know, comfort and purpose and function. So I love that you gave us that example. So thank you for being here with us.
Thank you for having me.